Have you heard the story about cold drinks? Some insecticides poisoning in. Have you heard? Sometimes before we heard that pesticides being using in cold drinks. After that, people start avoiding cold drinks. Have you heard? No. Okay. So xenobiotics are nothing but the substances we are consuming accidentally, like pesticides. Okay. Sometimes used drugs in disease conditions. Okay. Some substances produced inside our body, like bilirubin, like steroids. These are all xenobiotics. Okay. Pesticides are xenobiotics. Any food coloring substance, any additives, these are all xenobiotics. Xeno means foreign substance, gas-like substance. Biotics means a substance, biological substance. They have no any nutritional value inside our body. So they have to detoxify, neutralize, so that body can excrete them via urine or feces or via sweat, like this. Okay. So today's this topic is small topic. You may ask in exam about short note of xenobiotics, short note of Cytochrome P450 enzyme system. You may ask phase 1 reaction of xenobiotics, phase 2 reactions. Okay, you may ask biotransformation about short note. Okay, so please silence, don't talk please. So xenobiotics are compound which are may be accidentally ingested or taken as drugs, or compounds produced in the body or may produced by bacteria or fungal metabolism. You may heard cholera, disease cholera. So responsible bacteria is Vibrio cholerae. Cholera make a toxin inside our body, inside our gut. That is called cholera toxin. This is one type of xenobiotic. You may heard of fungal. Fungus was called aspergillus. It produces one toxin called aflatoxin. This is one type of xenobiotics. Understand? So what is biotransformation? This is a process where a substance is changed from one chemical to another by a chemical reaction within the body. The organs involved are liver, kidney, intestine or skin. Okay. There are two types of biotransformation. One is detoxification. There is one toxic substance can be detoxified. And another is intoxication or bioactivation, where one chemical which is actually non-toxic. So after transformation it become toxic, like methanol. You may heard sometime newspaper on alcohol poisoning. Some people in village area, they consume alcohol and eventually they become blind. They become sick. They get admitted in hospital with complaining of severe sweating, diarrhea, with difficulty in vision. These are because of methanol poisoning. Because methanol, when consumed, the methanol become formic acid. Okay, so this is one type of intoxication. Methanol is relatively less toxic, but after changing inside our body, it become very, very toxic. Formic acid. Understand? So detoxification is a process, biological process, where the noxious substances are rendered less harmful and more water soluble, are known as detoxification. Say a toxin, say one Xenobiotics, when ingest, it actually hydrophobic in nature. It actually dissolve in lipid. So we have to make them hydrophilic. That is, they have to become soluble to water so that body can excrete. Okay. So you can understand easily, in a lipophilic substance, it tends to become toxic. The toxicity can come if we cannot excrete them. Example, organophosphorus poisoning. When I was working in medical college, one day I was on duty. I seen one patient come to emergency, complaining of severe sweating, difficulty in vision, respiratory difficulty. So when we asked them when he started this problem, he told he was on paddy field. He was spraying some insecticides, but he was on as a some village people, they usually do not frequently use shirt or cover their body. So eventually he got intoxicated because his skin was exposed. So via skin he got exposed with organophosphorus and eventually toxicity developed. Organophosphorus actually, they easily dissolve with lipid. They can easily absorb via skin. So compounds that are detoxified include compounds accidentally ingested like preservatives, as I told earlier, food additives, food adulterants, drugs taken for therapeutic uses. These are all have to detoxify. We will read it in your pharma classes in future lectures. When you study pharmacology, this topic will help you. We will read elaborately during your pharma classes. Right now, just take some basic concept about this. What is toxification or bioactivation? Here, biotransformation is not exactly synonymous with detoxification, since it may, in many cases, the metabolites are more toxic than the parent substance. This is known as bioactivation or intoxication. As I told earlier, methanol, when you consume and after metabolism inside body, it becomes formic acid. It is highly toxic. Another is vinyl chloride. Vinyl chloride changes into vinyl chloride epoxide, which actually binds to DNA and RNA, and it becomes carcinogen, lead to liver cancer. Vinyl chloride is a substance sometimes used in chemical industry, plastic industry. Vinyl chloride. Some endogenous substance which our body produces, like bilirubin, they also actually xenobiotics. Bilirubin, steroid, these are body produced inside a body produced. They are also called xenobiotics. So we may ask you in the Bio exam, tell me some example of xenobiotics produced inside our body. Okay. So answer is very simple. Bilirubin, please remember. Another is steroids. Examiner may ask you in the exam, please tell me some xenobiotics which are produced inside our body. One is bilirubin, another is steroid hormone. Apart from that, some bacteria toxin, fungal toxins can also produce. So biotransformation of the lipophilic bilirubin molecule in the liver result in the production of water-soluble, that is hydrophilic metabolite excreted into bile. So bilirubin is toxic to the brain, especially in newborn children, where their conjugation is poor. Their conjugation still not developed. The liver actually poorly developed. As a result, the newborn children tends to, if they develop hyperbilirubinemia, the bilirubin causes crossing the blood-brain barrier, eventually damaging the brain. That is called cardiac arrest. Okay. This bilirubin is toxic. We have to excrete it out from our body. Any question till now? Understand everyone? No question? Okay. So compound produced by bacteria, metabolism. These are some example. Example is amines produced by decarboxylation of amino acid like histidine, histamine, lysine, cadaverine, ornithine, putrescine, tyrosine, tyramine, tryptophan, tryptamine. The transformation of a specific xenobiotic can be either beneficial or harmful, and perhaps both depending on the dose. As I told, xenobiotics after biotransformation, they may become more toxic, or they may even detoxify. They are some compound of bacterial metabolism. Just remember 2 or 3 at least. You may ask in the bio exam. Biotransformation of drugs. A typical example is acetaminophen, like paracetamol. Have you heard the name paracetamol? We also call it acetaminophen. It is commonly used in fever and pain. It normally undergoes rapid biotransformation with the metabolites quickly eliminate in the urine and feces. Hence, toxicity is very less, or not observe any toxicity. But at higher doses, the normal actually the enzyme saturated. So the excess acetaminophen undergoes additional biosynthetic pathway, which actually are toxic to the liver. So paracetamol in very high dose causes liver toxicity. Please remember. Treatment, we use N-acetylcysteine. You will do it in your pharma classes, in future lecture classes about this thing elaborately. Okay? Still not just remember this thing. Imagine the bio exam, the drug used for paracetamol toxicity or acetaminophen toxicity. This is the drug, N-acetylcysteine. Okay? Let's go. This is very important. You may ask in exam about short note of Cytochrome P450 system. Okay. So these are actually are enzymes present in liver, endoplasmic reticulum. They are actually heme containing enzyme. Okay. They are the maximum absorbance observed in 450 nanometer in presence of carbon monoxide gas. This is the reason they named as P450. There are several types of this enzyme present in our body. Up to 150 types of Cytochrome P450 are present. They are the enzyme. They are mostly these are the enzymes. They detoxify or we consume drugs inside our body. Even some other xenobiotics also detoxify by this enzyme. They form the first line defense employed for a biotransformation of xenobiotics involving oxidation reaction, mainly phase 1 reaction. What is phase 1? I am coming later. Just now, focus here. What is about Cytochrome P450 system. They may add reactive groups like OH group, COO- group, amide group through oxidation, reduction, or hydroxylation process. These enzymes are monooxygenases that absorb light at wavelength 450 when exposed to carbon monoxide, hence the name P450. This is the common reaction. One, Xenobiotics, it add oxygen with presence of NADPH, not NADH, and then change into ROH, water and NADP plus. So please remember, Cytochrome P450 system, they use NADPH, not NADH. Okay, so this is the reason they produce reactive oxygen species. What is reactive oxygen species? Any idea? Anyone? They are actually unpure electron, highly reactive electron, and it actually damages in our body. Some detoxifying agents, example, antioxidants are actually they neutralize reactive oxygen species. Antioxidant vitamins, anyone? Antioxidant vitamin C, vitamin E, some extent vitamin A, okay, enzyme, some enzyme, superoxide dismutase, glutathione reductase, okay, some substances like coenzyme Q, these are all antioxidant. Please everyone read this Cytochrome P450 system. This is very important in your exam purpose. You may ask short note. Why it is called P450 system? Because maximum absorbance observed at 450 nanometer in presence of carbon dioxide gas. P denotes protein or product, anything. Protein, P. Okay. They are present in endoplasmic reticulum of liver, especially. There are several types of cytochrome oxidase. They are like CYP-A to E with several subclasses. Almost all common drugs are metabolized by P450 system. There are about 150 isomers of Cytochrome P450 system enzymes are there. They are classified according to structural homology into family, subfamily, etc. CYP is a accepted abbreviation. For example, CYP1A1 denotes that it is a Cytochrome P450 belonging to family 1, subfamily A, and the first bar of that subfamily. By this way, the scientists give nomenclature. Okay. Their function is to transfer electron from NADPH to Cytochrome P450. This leads to reactive activation of molecular oxygen. One atom of oxygen is inserted into the substance. Here you can see Cytochrome P450 contains phosphatidylcholine, and there are several families of this enzyme which are substrate specific and encoded by different genes. Okay. They are inducible enzyme because if you induce by substance, say example, if a person consume alcohol every day, in initial phases he may take less amount of alcohol, but as the time progresses he have to take more amount of alcohol. You can see. So in that cases, what happen? The alcohol actually metabolized some extent by a Cytochrome P450 system. So by the time progresses, the enzyme become induced. So more amount of alcohol can metabolize rapidly by that person. Understand? Sometimes we use some drugs. Example, phenobarbital. In neonates, we give sometimes phenobarbital to induce that enzyme so that this enzyme can neutralize bilirubin unconjugated into conjugated form. So, cytochrome P450 system enzymes are actually inducible enzymes. Phenobarbital causes increased activity of this enzyme. The anticoagulant warfarin is metabolized by this CYP2C9. If the same patient is taking phenobarbital, the enzyme is induced, the level of enzyme is increased, warfarin is broken down quickly, and the dose of warfarin become inadequate. Okay. Similarly, ethanol induces CYP2E1, which metabolizes many carcinogens. Thus, the risk of carcinogenity is increased after use of ethanol. CYP1A1 and some other members of family are used in metabolism of polycyclic aromatic hydrocarbons (PAHs). So, this group is sometimes called aromatic hydrocarbon hydroxylases. Cigarette smoke contain various aromatic hydrocarbons. These are activated by AHs. Some of the isoforms of enzyme exhibit low catalytic activity. This explains the variations in drug response among different persons. For example, there are 3 alleles of CYP2A6 which catalyze the metabolism of nicotine of tobacco. The person with inactive allele is protected against addiction of tobacco. The P450 enzymes are seen in many tissues including adrenal glands where they are present both in mitochondria and microsomes. The mitochondrial P450 enzymes utilize NADPH linked flavoprotein adenoxin reductase, a non-heme iron sulfur protein, and adenosine. They are mainly involved in steroid biosynthesis. Okay, so everyone go to this cytochrome P450 system because this is a very important enzyme. As a medical student, you have to know this. In your medical life, you will found this enzyme frequently. You read this term frequently in your textbook. So please read this very important enzyme. Cytochrome P450 system enzyme, CYP enzyme. Some basic thing you have to remember. What is cytochrome P450? They are heme containing enzyme. They are present in endoplasmic reticulum, especially in liver, apart from the kidney, adrenal cortex. Okay. Why it is named as cytochrome P450? Because in presence of carbon monoxide gas, maximum absorbance observed is in 450 nanometer. This is the reason they named as cytochrome P450. Their function is to detoxify, xenobiotics, drugs. They may be inducible enzyme. So, if they induce the enzyme, metabolism increases one type. If you prescribe more than two or more than one drug, one enzyme may neutralize one drug. Eventually, another drug may produce toxicity. Okay. There are several types of cytochrome P enzymes present inside your body, more than 150 types, and they have different gene locations. Okay. They use NADPH that then may produce reactive oxygen species. So if one person consume toxin type substance like alcohol or some other things may eventually develop carcinogen because of the exposure of free radicals. Okay. Next is detoxification phases. There are actually two phases of biotransformation reactions, phase 1 and phase 2. Phase 1 reaction results in formation of compounds with decreased toxicity. Sometimes this may result in increased toxicity, that is called intoxication, like methanol to formic acid. Phase 1 reaction include hydroxylation, oxidation, reduction, hydrolysis, dealkylation, epoxidation. So, if we ask, examiner asks short note in your exam, everyone have to write these terms. Phase 1 reaction, at least 3 to 4 terms you have to write. Hydroxylation, oxidation, reduction, hydrolysis, dealkylation, epoxidation, etc. Phase 1 reaction. With, if possible, write 1 or 2 example. This is phase 1 reaction. First one is oxidation reaction. Oxidation reaction, it may be either aromatic or aliphatic hydroxylation. The reaction also include sulfoxidation and oxidation and epoxidation. For example, toluene is hydroxylated to benzyl alcohol by mixed function oxidase system. Here you can see benzene is oxidized to phenol in phase 1 reaction. You can see toluene is oxidized to benzyl alcohol. It uses NADPH and molecular oxygen. Okay. Everyone trained textbook, don't have to write anything, just see this. The oxidation and detoxification of alcohol is also an important function of liver. The enzymes are involved in this process: alcohol dehydrogenase, oxidizes alcohol to aldehyde, and aldehyde dehydrogenase. Oxidation of some compound may result in production of substances which are more toxic, like methanol, formic acid, ethylene glycol, oxalic acid. Okay. Methanol actually used in to coloring, what is called actually coloring in woods. Methanol. Okay. Next, see this ethyl alcohol, which uses NAD plus and produce NADH plus H plus and combine into acetaldehyde. Again, the acetaldehyde, it uses another NAD plus and combine into acetic acid. Okay. So this is biotransformation. Again, this benzaldehyde, it uses NAD plus, produces benzoic acid. Okay. There are some oxidation reaction. Next, reduction reaction. In some reactants also contain Cytochrome P450 and flavoprotein in nature. The major group of compounds which are reduced and detoxified by liver and are nitro compound. These are reduced to their amines, while aldehydes and ketones are reduced to alcohol. Example, is reduction of nitrobenzene to aniline. Other example like picric acid, picramic acid, para-nitrophenol to para-aminophenol. Okay. So you have to write one acceleration reaction with example, say alcohol, metabolized to acetaldehyde, again acetaldehyde combined into what? Acetic acid. This one type of oxidation reaction. This is another example reaction. You have to write one or two examples. Next is hydrolysis reaction. Hydrolysis is a chemical reaction in which the addition of water split the toxins into two fragments or smaller molecule. The hydroxyl group OH is incorporated into one fragment and the hydrogen atom is incorporated into another atom, another fragment. Esters, amines, hydrolyzins, amides, glycosylic bonds and carbamidase is generally biotransformed by hydrolysis. Example is aspirin. This is a drug. Acetanilide, procaine, xylocaine, aliphatic esters, etc. Aspirin is a drug we used as painkiller, anticoagulant. Aspirin can be biotransformed like this reaction. Hydrolysis reaction. Xylocaine is a local anesthetic drug. Procaine is also another local anesthetic drug. Okay. Next, this is the reaction. Acetaldehyde combined to aniline plus acetic acid. Here it uses on water. So this acetaldehyde is split into two fragments, aniline and acetic acid. Aspirin combined with salicylic acid and acetic acid. This is some example of hydrolysis reaction. Okay. So you have to write one oxidation reaction example. You have to write one reduction reaction with example. You have to write one hydrolysis example. Okay, with example. If examiner asks phase 1 reaction. Next, phase 2 reaction. Phase 1 reaction, we may end up with some product. We have to go additional reaction to detoxify them or excrete out from our body. Please remember, in phase 2 reaction, there are 5 types of reactions. Acetylation reaction, methylation reaction, conjugation reaction, cysteine and glutathione reaction, and glucuronic acid. These are the 5 types of reaction occur in phase 2 reaction. Please don't talk. Please. I am telling you repeatedly, phase 1 reaction you may ask in exam a short note. Phase 2 reaction you may ask in the exam a short note. So everyone have to write what is phase 1 reaction with some example. Please don't talk. তুমি সামনে এসে বসো, এখানে আসো। তুমি চলে এসো সামনে, বেশি কথা বলা হবে না। সামনে এসো, তাড়াতাড়ি আসো। Okay. So phase 2 reaction, what is phase 2 reaction? Xenobiotic that has undergone a phase 1 reaction is now a new metabolite that contains a reactive chemical group like hydroxyl group or amide group and carboxyl group. These metabolites must undergo additional biotransformation as a phase 2 reaction. So everyone write these lines. While writing phase 2 reaction, everyone write these lines. Phase 2 reaction was conjugation reaction. There is a molecule normally present in the body added to the reactive site of the phase 1 metabolite. In most cases, the conjugation will make the compound non-toxic and easily excretable. Conjugating agents and their active forms are like this: glucuronic acid, EDP, glucuronic acid, sulfate, PAPS, cysteine, glutathione, acetic acid, acetyl-CoA. These are some examples. There are 5 types of reaction in phase 2 reaction. Please remember: fast reaction, acetylation, methylation, conjugation, cysteine and glucuronic glutathione reaction, and glucuronic acid. I am telling you again, this concept will also help you in future lecture classes, in pharmacology classes also. Okay. In our body, we consume drugs. The drug undergo biotransformation like this. Okay. Next, what is acetylation reaction? This is conjugation with acetic acid is taking place with drugs like sulfanilamide, isoniazide, PAS, para-aminosalicylic acid, etc. This is isoniazide. Actually, this is anti-tubercular drug. We use these drugs in tuberculosis treatment. Isoniazide undergo this reaction. It requires an acetyl transferase enzyme with acetyl-CoA and combined to acetylated isoniazide. Sulfanilamide is sulfur drug. It also uses this same enzyme and they undergo acetyl sulfanilamide. This is acetylation reaction. Next is methylation reaction. Amino, hydroxyl or thiol groups are methylated, like S-adenosyl methionine is the methyl donor and enzyme is usually O-methyl transferase. For example, catechol O-methyl transferase convert epinephrine to metanephrine. Pyridine is excreted as N-methyl pyridine. Mercaptoethanol is excreted as 5-methyl mercaptoethanol. But methylation decreases the water solubility rather than increasing it. Metals like mercury may be methylated, making them more lipophilic, increasing permeability and causing neurotoxicity. So, mercury is a metal. If anyone consumes mercury, it may end up with toxicity because mercury cannot undergo biotransformation. Some metals will cause a toxicity. One is mercury. Another one, বলতে পারবে? Metal poisoning, mercury, arsenic. Have you heard the term arsenic? Arsenic, aluminium. These metals are actually not useful in our body. Iron, very useful, but if you consume high level of high dose of iron, or the patient undergo repeated blood transfusion, eventually they become iron overload, causes toxicity. Copper, very useful element, trace element, but anyone exposed to copper for long time, eventually it leads to copper toxicity, like Wilson disease. Okay. Not useful metals are mercury, arsenic, aluminium. If they are exposed for prolonged period, causes toxicity. So first one is acetylation reaction. Here some drug like isoniazide, PAS, sulfanilamide, they undergo this reaction. Here conjugation with acetic acid is there. Example, isoniazide, isoniazide. Example. This is methylation reaction. Here amino hydroxyl or thiol groups are methylated. Example, catechol orbital transferase convert epinephrine to metanephrine. Pyridine is acetylated and methyl pyridine. Markup-ethanol is acetylated 5-methyl markup-to-ethanol. These are some examples. Okay. Next, conjugation reaction. Here sulfate conjugation, like phenolic and alcoholic compounds are conjugated with sulfate enzyme sulfotransferase. Conjugation with glycine. Here benzoic acid is conjugated with glycine to form hippuric acid, which is excreted in urine. There is an example. Benzyl-CoA conjugated with glycine and forms hippuric acid. Phenyl acetic acid conjugated with glutamine and produces phenyl acetyl glutamine. Okay. First one is acylation reaction. Next is methylation reaction. You have to write one example. Next is conjugation reaction. Okay. Next come cysteine and glutathione reaction. Cysteine is, what is cysteine? Amino acid. Okay. Cysteine is derived from glutathione, which is active conjugation agent, alkyl or aryl halides, epoxides and alkanes are detoxified in this manner. Say this is example. One Xenobiotics RX, it reacted with glutathione produces GSR, reduced glutathione. This substance, this is the enzyme GS transferase. Again GSR, which accepted with DGT produces cysteine glycine R and gamma glutamyl acceptor. Okay. Next, glucuronic acid. Glucuronic conjugation is the most common phase 2 reaction. This is the most common reaction. Bilirubin is a good example for compound conjugated and acetate as its glucuronide. Glucuronic acid can conjugate with hydroxyl, both phenolic and alcoholic groups, carbonyl, sulfhydryl and amino compounds. The glucuronic acid is added to xenobiotics by EDP glucuronation transferase. This is the enzyme present in liver, in endoplasmic reticulum. Say EDP glucuronic acid react with this xenobiotic. This is the enzyme EDP glucuronation transferase and produces R glucuronide plus EDP. This is water soluble. They can be excreted out. The drug metabolizing system induced by drug barbiturates induce barbiturate like barbiturate. It induces this enzyme glucuronide transferase and heme synthesis. As I told earlier, in newborn we often prescribe phenobarbital to treat newborn jaundice, neonatal jaundice. There are some example. Conjugation of with glucuronic acid, phenol, types of bond, glucosidic bond, products phenyl glucuronide, benzoic acid, types of bond, ester bond, glucuronic acid, monobenzoate, bilirubin, ester with propionic acid side chain, product is glucuronic acid, steroids, ester with OH group produces glucuronide of steroids, amines, types of bond, amide bond and product and glucuronides. These are example of glucuronic acid. conjugation. Okay. So phase 2 reaction, there are 5 types of reaction: acetylation reaction, methylation reaction, conjugation reaction, cysteine and glutathione reaction, and last one is glucuronic acid. Okay, everyone have to write these 5 names with example, one or two, just write one or two word, and with example you get full mark. Phase 3 reaction, it is very less, very uncommon reaction. Typical example is further conjugation with glutathione. Xenobiotics that enter the body are mostly drugs, and they are detoxified by the enzyme concerned with drug metabolism. Induction of Cytochrome P450 system may even produce unwanted effect in some persons. For example, induction of delta amino, this is not it, delta amino lipoic acid LAS in this by barbiturate will precipitate attacks in acute intermittent porphyria. Okay. Beneficial effect of induction is utilized in newborn to induce glucuronidase transferase enzyme by barbiturates. This is the phase 3 reaction. This is not so important. Just listen this time. Phase 3 reaction. In some cases, the xenobiotics may be converted to harmful compounds by the cytochrome P450 dependent oxygenases, like benzopyrene is converted to carcinogen by epoxidation. Effects of a particular drug may vary from person to person. The drug metabolizing enzymes may show genetic variations. This may lead to decreased or increased or absent expression of enzyme activity. Those who metabolize the drugs sluggishly may show toxic manifestations with normal doses of the drug. So this is the reason one drug on different individual have different type of effect. Effect is same, but intensity of effect is different because the enzyme activity. Okay, metabolism capacity of a particular person is vary from one person to another. Say example, 5% taking same dose of drug, all the 5% may have different type of effect because the metabolism of capacity. Understand? বুঝতে পারলে সবাই? This is one important, you may ask in the exam, a short note. Paraoxonosis, PARAO, paraoxonesis. Paraoxonesis 1 also play important role in antioxidant in preventing the oxidation of LDL. LDL is long-duration lipoprotein present in the body. Its serum concentration is intensified by inflammatory changes. Okay, LDL, a person has high level LDL, you may think that the person may develop heart disease, coronary artery disease in future. Okay, this is not LDL responsible for coronary artery disease. This is the oxidized LDL. Okay, oxidized LDL is actually causes coronary artery diseases. Paraoxoneases are a family of enzymes with aryl alkyl phosphatase activity. There are 3 paraoxonease isoenzymes which are involved in the hydrolysis of organophosphorus. Organophosphorus actually poisons. They use in as a insecticides in paddy fields on cultivation. We just read this. They are not so important right now. It is written in a textbook, that is why I have taken this. A case discussion. A 20-year-old female was brought to emergency department with nausea, vomiting and complaining of abdominal pain. She had been under a lot of stress with final examinations. In her hostel room, her friends noticed an empty bottle of acetaminophen near the bed with numerous pills lying on the ground. On arrival to the emergency department, the patient was found distressed with vomiting. Laboratory test revealed hypokalemia and elevated liver enzymes. Her white blood cells count was normal. Her acetaminophen level is very high, 200 femtogram per ml. The emergency department physician gave a gastric lavage and then prescribed oral N-acetyl system. What is the pathophysiology of the liver toxicity? What is the biochemical mechanism whereby the N-acetyl system help in this condition? So this is a straightforward question asking about paracetamol poisoning. So here you have to write the mechanism of paracetamol metabolism, how this produces toxicity. Any question till now? So this is a small topic, xenobiotics. So you have to read what is xenobiotics, what is biotransformation, okay, what is phase 1 reaction, what is phase 2 reaction with example. Any question? No question? Thank you.